In my initial vision, every city would have a sexual health center, especially in Asia, where sexual health is often a taboo. HPV is a very common infection, and it can be transmitted from skin to skin contacts. In women, we know almost 100% of cervical cancer is caused by HPV, but HPV can cause other cancer in male as well. Now there's increasing number of men getting oral and pharyngeal cancer in their head and neck, and also it can involve in anal cancer, penile cancer as well. We don't know where the woman get their HPV from if we don't know whether the man has HPV. I think knowing how HPV evolve in men and how they can be treated is also very important, and that's why we've been doing male HPV tests for almost 10 years now. We estimate roughly about 50% of male who may be carrying HPV. We estimate just looking at about 2 to 3% of the male population doing the test, and that's about 200 to 300,000 per year. For HPV, it's a virus that's inside the skin. It's not on the surface of the skin. So for men to collect the sample, we need to first remove the surface layer before we can get to the cell that has the infection. Previously, a lot of study, they would just use a cotton stick to try to get male sample, and the yield is very low. Normally, cotton stick will not be able to remove the surface layer. So that's why in the past we had to use a very fine sandpaper to actually brush off the surface layer and then to collect it. But it is a little bit more cumbersome. So when you have two steps, what we want is to standardize a sample collection method, almost like taking blood. For 1 cc of blood, you can measure what's in it. But from one swab sample, you can't tell how much is in it because everyone may take different amounts from it. When we develop NanoSwab, we have a fixed surface area, and by using that surface area, we can collect the number of cells proportional to the number of scraping onto the skin surface. We spent about 2 years in developing the product. NanoSwab will be not quite the same as a test kit, but at least it's like the sample collecting stick that we use for COVID test. From our testing, almost 99%, whether it's a clinician or patient themselves, can collect enough cell for HPV test. Previous way, our method with using sandpaper is over 90%. Without using the sandpaper, it's less than 10%. We first developed NanoSwab for HPV. However, I think NanoSwab can be expanded into other applications in cosmetics for skin testing. So other dermatological applications is what we are looking at. Skin cancer detection. So potentially if NanoSwab can replace a skin biopsy, for example. We are actually developing our manufacturing site. So we have got the location ready. So now it's the matter of putting up the equipment. Our initial target is to have a production of about 100,000 sampler on a monthly basis. That's in Hong Kong. For making this NanoSwab, we try different material. We need to consider the comfort, the flexibility, because skin is not flat. Some are more difficult to handle, some may easier to break, some may not be as durable. And I think in other field of medicine as well, we need different specialties working together in collaboration to create something new and be innovative.
I've known Dr. Fong for quite a long time. I started working with small to medium-sized companies, helping them with business strategy and their corporate finance and capital raising. Every company is really two different companies. One aspect of the company is their subject matter expertise. For Neo Health, it's healthcare and related science. But every company has to also be a second company which has all the business, finance, and administration areas to be commercially successful.
Maintaining the clinical background is very important, so we know what's needed in the field. But on the other hand, being entrepreneurs is to how to expand that clinical service. If you are able to develop a kind of service or a product that can be used by others, that's scaling up. The reason we want to enter into Science Park is to enter into an environment where it encourages innovation and collaboration. So after introduction from Science Park, we worked with NAMI. NAMI's specialty in material. We have tried 3 different materials. We have tried different shapes, so probably about 5 different shapes. And also the NanoSwab pore itself, we have made different dimensions, different shapes, just to find out what's the optimized sample collection shape and thickness. So there's a lot of variability in the testings.
The expenditures up until the start of this year were on the fundamental R&D, and that was approximately Hong Kong 2 million. We've added about another 400,000 of expenses in intellectual property registration, so approximately 2.5 million to date. Hong Kong is fortunate in that it has a lot of different sources of funding. So even though private sector funding may be more challenging, the government's been very supportive through various grant programs. We are also a tenant at Hong Kong Science Technology Park. We are in the process of applying for their acceleration program, which provides funding. There's all the other elements of the ecosystem, the facilities, the laboratories, and the other companies. So it's a broader offering at the Science Park, whereas the government is just providing grant funding. There's several sectors the government is trying to support now. Been supporting the fintech sector. They're also getting involved in AI and Web3, but health tech is certainly one of the core programs they're focusing on right now, which I think is understandable because of the relationship Hong Kong has with China, and the healthcare needs in mainland are very great. I think Hong Kong is unique in that it sits independently between mainland China and Southeast Asia, both of which are huge potential markets. There are equally growing needs for the 700 million or 800 million people in Southeast Asia.
The first thing is not to worry about making mistakes. Everyone makes mistakes, and it's better to learn from someone else's mistakes as well. You need to do market research, talk to people in the field, and see what's in the market and what are the competitors doing. And for a lot of the biotech products or health-related products, the development time is very long. Having a vision what would be in need in 10 years' time is very important. You don't necessarily know the return, so it's a gamble. But I think it's a nice way that we know the needs, we know there's the field, and we are in a better position to make that bet.